you realized, wait a minute.
And the FDA as well. Right. This morning we talked about in the newsletter how the FDA is now rolling back a lot of these emergency use authorizations that they used so willy-nilly in the last decade.
Yeah. I mean, it's really stunning. And to see, going through these early transcripts of his speeches in early 2020 and 2021 as these vaccines were rolling out, it's interesting to see him change because he's saying, wait a second, I'm not going to, there was the second dose of Pfizer's vaccine that people needed to get. And he, as governor, was like, I don't think that's necessary. And they're like, whoa. And the liberal media was like, whoa, wait a second. But Pfizer's telling us you need to get that second one. And DeSantis is saying no, not to. And then CNN does a whole little series on DeSantis where they analyze DeSantis and they reluctantly are pointing out, because he's there like, look, Miami is booming. We didn't shut down. Miami, people are on the streets, businesses are booming. Go to Los Angeles and it's it's totally dead. Totally different story in Los Angeles. Here in Miami, though, it's booming. And CNN was like, well, he was right. And they're like, I guess we have to admit this. So there was an evolution there, definitely. But now the evolution has gotten to a point where Ron DeSantis is saying that the Americans need to unify behind the science that has led to the rapid development of vaccines. Initially, that's what he was saying. And then he evolved and says, basically we were lied to by these people. And it didn't take long because now DeSantis is back and planning to hold Pfizer and Moderna accountable over false statements about the vaccines. He says his Surgeon General is working on this. Watch.
Be able to show and how they marginalized people that were speaking the truth on COVID was really, really damaging. And it ended up killing people because people would tell the truth and they would get deplatformed on Twitter. We're also going to be doing some stuff because I have a Surgeon General in Florida, Dr. Joseph Latipo, who's been really, really strong of just fighting back against the narrative and the phony things that people are trying to do and focus on the evidence. And so, we are going to work to hold these manufacturers accountable for this mRNA because they said there was no side effects, and we know that there have been a lot. And so we did a study in Florida, and you saw an 86% increase in cardiac-related activity from people 18 to 39 from mRNA shots. And so we're going to be doing some stuff to bring accountability there because I think it's just something where...
So this is interesting.
86%, holy cow.
Yeah. So why is the media ignoring this story? Totally ignoring this story. Do a Google search for Ron DeSantis Pfizer. Do a Google search for DeSantis mRNA.
Trump Santis to them. You know what I mean? They put him in the same category as Trump.
You won't find a story on it, though. Even the Florida press ignoring the story. He's there at the governor's mansion dropping
because they
a
are
bombshell
sponsored
story.
By Pfizer.
Yeah. Oh, I
and
wouldn't doubt
Moderna.
It.
And so
yeah, if you go to Orlando Sentinel's website and probably dig around for some advertising, go to Tampa Bay Tribune, Miami Herald.
They also, they don't cover a lot of the document releases that we've seen from Pfizer. Mm-hmm. They don't cover adverse reactions. They just don't.
But here's your governor speaking about a major bombshell story. This is the first governor in the nation to say that they are going to actively go after these biopharmaceutical companies, and now for lying.
Because actually because Pfizer has an immunity, and so does Moderna, and so does, I believe, Johnson & Johnson and AstraZeneca. They have immunity from being sued by us,
right.
People. Do they then, though, have an immunity at the state level? This is an interesting question.
And under what immunity? I don't know.
Because vaccines were rolled out federally.
Right.
And so can a state even do that? What's the jurisdiction? These are important questions that I'm sure legal minds have already tackled.
So he admitted that basically he says it here without saying it here, that lawsuits are coming. Get ready because lawsuits are coming.
My question is,
we wouldn't let them mandate on you in Florida. We said, no, because like Orange County wanted to fire firefighters, Gainesville wanted to fire people, but even the corporations like Disney wanted to fire. So we said no across the board. So everybody had the ability to opt out of anything they were trying to impose on you. But there are other people around the country that got forced to take this. And then what? They're not allowed to sue or get any type of recourse when this is not something that they wanted to do. So this is something that we're going to lead on in Florida. So we're going to have probably some announcements over the next 3 or 4 weeks on that. But we're happy. Just think about...
So like reimbursement.
I'm listening.
I mean, let's unpack that. What do you think? I mean, reimbursements for being forced to get a jab.
Well, you can't reimburse lives that were lost.
Right.
No, but you can reimburse for anyone who, well, let's say they felt coerced to do it by an employer, or because we've already seen litigation like that around a private health insurance. So people who were fired for not complying and people who complied in order to keep the job are also eligible for settlements.
Well, then my question is, are they able to get those protections on a non-approved drug? Like, it's still emergency use authorization. It's not like technically approved. So does it say anywhere like that they have the protections when it's an approved drug, or are they just protected no matter what?
Well, that had to do with why was it the FDA that had voted to put it in place for children?
Right.
Because the putting it in place for children's regular vaccine schedule meant that they were able to then have liability going forward. So perhaps, but again, this is a really interesting question of jurisdiction because COVID vaccines were rolled out by the federal government and paid for by the federal government and then sent to the states. So it brings up the question, what individual choice did state governments have? Did they have any? Could Ron DeSantis have said, no, not for Florida, we're not doing this? And then someone would have had to cross state borders if they wanted to. Could he have said, oh, we're only doing it privately in Florida and we're not going to do it through the government? Like, we don't know. We don't know these questions.
Well, we do know that it's gone all the way to the Supreme Court, I think in the early 1900s around the smallpox vaccine. So there was federal precedent for federal jurisdiction over states' rights as it related to vaccines.
If you look at the marijuana stuff, like that's kind of a good, where a lot of states, because that's federally illegal still, and there's a lot of states that are doing it, and it's the federal government has just decided not to go into those states and do something about it. And I think this would be the same thing. States can decide to do things. It's just like they're going to lose funding on a lot of things if the government's like, hey, look, if you don't comply, you're losing this funding, you're losing this. So it's just like a decision. I think they could. But then the federal government could either go in and enforce it at the federal level, or they can remove funding and try to basically sanction the state.
So then my sort of envisioning of this litigation would be the state of Florida versus the FDA or the CDC or Pfizer, Moderna for giving us these data points they knew were wrong. And we've already seen that. We saw that in the case we spoke about last week about Albert Bourla on the BBC saying that something about the infectious level of COVID for children that was not proven and getting in trouble with the British government for that.
Right. So now the FDA, speaking of the FDA, Pfizer is asking the FDA now to clear updated COVID shots for kids under 5 years old. So let's look at this. Here's the Los Angeles Times headline this morning. Pfizer is asking U.S. regulators to authorize its updated COVID-19 vaccine for children under age 5, not as a booster, but as part of their initial series of shots. Children aged 6 months through 4 years already are supposed to get 3 extra small doses of the original Pfizer COVID-19 vaccine, each a tenth of the amount that adults receive, as their primary series. If the Food and Drug Administration agrees, a dose of Pfizer's Omicron targeting vaccine would be substituted for their third shot. Pfizer and its partner BioNTech said Monday that change could help prevent severe illness and hospitalization from COVID in little children, at a time when children's hospitals are packed with youngsters hit by other respiratory illnesses.
Mm-hmm. Okay.
What kind of clown world are we living in?
I don't know. I guess you don't need an emergency to declare an emergency. This is like,
what
how our kids think it's an emergency to find their shoes in the morning. Like everything's an emergency.
Do you remember the movie Dope Sick, where that sinister looking pharmaceutical guy is in the meetings and he's like, we're going to make more profits. I'm going to do that. It's like, I can just see them in these meetings talking about going to the FDA. Let's take it to 6 months year old kids. We can make a ton of profit if we make these mandatory. It's like you just see Dope Sick playing out in real time.
Yes.
Well, and because we've already heard that they can't figure out a way to sort of monetize long COVID. Right. So the people who have had, long COVID as a result of, getting it, but also, anyway, they can't figure out a way to monetize that because they don't have like some sort of a solution for long COVID yet. So how do we then, we've got to also figure out other age brackets to really target. Now let's make this a mandatory part of your series with the federal government. Like unbelievable that we would have this as part of your child's inoculation schedule as part of their initial series of shots. And, I guess, and I hope you can opt out of this stuff. I mean, as a parent, right? I mean, I don't know. If you go to public school, though, they may mandate it.
That's on a state-by-state basis.
So what states are going to say you have to do this? Others, you're going to have a mass migration. Like if you have certain states that are like, yeah, you absolutely have to do this in New York, et cetera, but you don't have to do it in Florida. You don't have to do it in Texas. You already see a mass migration of people leaving those states to get out of there.
Yes. And you see a lot of the litigation now has to do with the religious exemption as well, because a lot of people have tried to use that as a reason not to have to comply with mandates. That hasn't done so well in the courts up to now, but some states disallow religious exemption. Some states, require it on certain basis. It's wild.
And one more final point on this is that other governors could soon follow suit with Governor DeSantis and maybe in different ways. So Governor Youngkin of Virginia announcing that he's ending the COVID-19 fines and penalties in Virginia, and he wants reimbursement process in place for those who had to pay unjust fines. So you may start to see this now.
It would be awesome if a bunch of states got together and did kind of like a class action kind of thing. It's like all these states go after them at once, because that would be a lot harder for them to fight if it was like, 5, 6 big states going after them.
Yeah. Actually, I disagree because I think that more individualized lawsuits hurts more than when they join up, because when they join up, they have just one chance. And one chance for dismissal. And if it's dismissed, that's it.
That's a good point.
But if they go at them separately for different things, like right now we see the Missouri and the Louisiana attorneys going after the attorneys general, going after the Biden administration for censoring information around the pandemic. That is one piece of it only. But if somebody else takes a whack at vaccine information or information disseminated through the Biden administration or through the Trump administration or what have you.
Fines.
The fines piece is interesting. Do they mean fines for breaking quarantines, or what fines were in place? I didn't think people were getting fined for not having the vaccine.
No, but fines for businesses opening,
like
small businesses.
a day.
Yeah, if you were operating without putting in proper COVID protocols at your business and things like that, like plexiglass, which did nothing, like that kind of crap.
That was the argument at the beginning. Because a lot of those places were charged $1,000, and the Walmarts, the Targets, they could afford it. So that was like a way to initially start closing down the small businesses that couldn't afford to do that.
Yeah.
Do you remember that company? There was that gym in New Jersey that made a lot of headlines, and people were like, "These meatheads, they just have this gym open, they won't close down," and they were refusing to close down. And New Jersey was like sent like the SWAT team to close them down.
That's right, they did.
Like these types of people, and like now it's amazing to be on the other side of this and to see these companies that got screwed by this.
I mean, it's really just too bad if you don't have your own private gym in New Jersey.
Right. I worked at Amazon right when the lockdowns happened, and it literally looked like a prison when you walked in. Like it was, you had the big, like they already had like the lockdown entrance, but then you'd walk in and there'd be like these little, you'd have to get in like a line, and they'd scan they'd take your temperature. There's plexiglass everywhere. I mean, it was like prison level. When they did this, like how insane they went with it. You couldn't talk to people. Like it was bizarre. It was bizarre.
That's crazy. Yeah, I mean, and think about, and that's just in America. Like we showed you the Chinese stuff earlier, like in our other segment. It's just awful, awful. Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.